It's time for another new Kansas City Spotlight. Here's your host, Lauren Scott.
Prostate cancer is the most common cancer amongst men in the U.S. and one of the leading causes of cancer death amongst men of all races. During Prostate Cancer Awareness Month, Optum is dedicated to educating the public on treatment options because your health matters at Optum. I'm Lauren Scott, your host for Kansas City Spotlight, and today I'm here with Dr. Lee Norman, Senior Medical Director at Optum, to discuss more about how you can treat prostate cancer. Hi, how's it going this morning?
Great, thank you, Lauren.
So tell me, what exactly is prostate cancer, and what are some of the symptoms that people can see?
Sure. Well, first off, only men have prostate glands. Maybe stating the obvious, but some people don't know that. The prostate sits right at the neck of the bladder, right at the outlet for the bladder, and the urethra goes right through the middle of it. So when it enlarges, because of a variety of benign and malignant reasons, one of the most common is obstruction of urinary flow, frequency of getting up and going to the bathroom at nighttime, and starting and stopping of the urinary stream. That's a red flag. It doesn't necessarily mean it's a malignancy, but it means it's something that needs to get checked out by early diagnostic procedures.
All right. So who should be screened for prostate cancer? What are some of the tests that you recommend?
Yeah, probably the most sensitive and the one most commonly used is called PSA, which is prostate-specific antigen. It's a blood test. Men between the age of 55 and 69 is kind of the key age range. If there's a prostate cancer history in the family, probably start that screening earlier. Older men beyond 70, if they haven't had any symptoms, probably don't need to have it done routinely.
So does every prostate cancer need to be treated?
No, there can be cancers of the prostate in older men, and they just monitor that with their doctor with some imaging studies to make sure that it's not getting worse. Younger men typically will need to be treated with some combination of surgery, radiation, hormonal, or chemotherapy.
Okay, so how is prostate cancer treated?
Well, the primary way in a younger man particularly would be surgical treatment. It could be radiation, either through beam or through implantation of radioactive seeds into the prostate itself, and sometimes hormonal treatment. Depends if it's localized to the prostate versus if it's spread to the rest of the body.
Okay, so let's talk survival rates for prostate cancer. What are we looking at here?
If it's caught early, it's almost 100% survival if it's just within the gland itself and caught early. If it's widespread metastatic, it drops down rather dramatically.
Okay, well, this is all fantastic information, Dr. Norman. If people want to learn more, how can they do that?
Go to our website, optumkc.com would be the first place I'd recommend.
Okay, all right. Well, thank you so much for joining us today.
Thank you, Lauren.
This Kansas City Spotlight has been paid for by Optum. For more information, visit optumkc.com.